Welcome to BLR training. While we may think of ADD and ADHD as childhood conditions, they are actually quite common in adults. Different adults may experience different symptoms that are not the same as symptoms that you may see in children with ADD, ADHD. And the symptoms can affect every aspect of a person's life, including the workplace. That employee you have that is difficult to motivate or has some disciplinary problems may in fact be suffering from ADHD. As a supervisor, you need to be aware of the illness, what to watch for at work, and how you can help. This training session will give you the foundation you need to understand ADD, ADHD, and what you can do if one of your employees suffers from it.
Hi, I'm Laura Piper, licensed clinical social worker. Every day, I work with all types of people, many of whom struggle with mental health issues in the workplace. During this training, I'll be talking about ways you as a supervisor can help your employees who may have mental illness. This session will focus on Adult Attention Deficit Hyperactivity Disorder, or ADHD. Note that for the purposes of this session, we will refer to both Attention Deficit Disorder and Attention Deficit Hyperactivity Disorder as ADHD. The main objective of this session is to help you understand what ADHD is and how you can help employees who are dealing with it. By the end of the session, you will be able to understand what ADHD is, know the causes and symptoms, understand how it can affect work, know what the law says, and learn how to manage employees with ADHD.
Before we begin the session, let's take a few minutes to see how much you already know about ADHD. When you're ready to begin, select Next. Select True or False, then Submit.
Employees with ADHD often feel work is more challenging than employees who do not have ADHD. Select the forward and backward arrows to learn more. 44.6% of ADHD sufferers experience behavioral problems at work versus 2.4% of non-sufferers. 32.6% of ADHD sufferers have quit a job due to boredom versus 15.5% of non-sufferers. 17.3% of ADHD sufferers have been forced to quit due to hostility versus 4.9% of non-sufferers. 17.4% of ADHD sufferers have been fired from a job versus 3.7% of non-sufferers. 11.1% of ADHD sufferers have been disciplined by their bosses versus 0.6% of non-sufferers. Adults with untreated ADHD lost an average of 22 days of productivity per year. ADHD sufferers earn $5,000 to $10,000 less annually than their colleagues without ADHD. ADHD sufferers have brain differences that begin in childhood. About 5% to 8% of children in the United States have been diagnosed with ADHD, and about 70% of those children still have symptoms as adults, which equates to 8 to 9 million adults with the illness. Often, adults do not know that they suffer from ADHD, especially if they were not diagnosed as children. They simply feel that they have shortcomings, and that they often feel bad about having the shortcomings. The main difficulties ADHD sufferers experience at work are with organizing, sustaining attention, avoiding distractions, and remembering things, all of which can have a big impact on effectiveness at work and working relationships.
ADHD has been thought to be a condition of childhood. However, research shows that as many as 70% of those diagnosed with ADHD as children carry the disorder into adulthood.
Now let's sort through some myths about adult ADHD. When you're ready, select the numbers to learn more about 4 of these commonly held myths. Myth: ADHD is just laziness or lack of willpower. Fact: ADHD may look like a willpower problem, but it isn't. It involves differences in brain structure. Myth: everybody has some symptoms of ADHD, and people should be able to overcome these difficulties. Fact: ADHD affects people of all ages. Although many people sometimes have symptoms of ADHD, some people suffer from chronic impairments because of it. Myth: unless you were diagnosed with ADHD as a child, you can't have it as an adult. Fact: many adults struggle all their lives with unrecognized ADHD. They haven't received help because they assume they just had shortcomings. Myth: since there is really no good treatment for adult ADHD, it doesn't matter if there is a diagnosis. Fact: actually, there are many effective treatments depending on the type and severity of symptoms. Treatments can range from something as simple as memory strengthening techniques to talk therapy to medication. But getting the proper treatment starts with getting an accurate diagnosis.
Adults with undiagnosed ADHD may have suffered for years with symptoms. It is possible to be evaluated and treated for adult ADHD. There are professionals who specialize in diagnosing and treating adult ADHD.
ADHD can affect job performance in many ways. People with ADHD tend to have trouble with some of the following work-related areas: time management, organization, listening and paying attention, following directions, procrastination, completing assignments, attending to details, getting to work on time, speaking in turn, sitting still, controlling emotions, and anger. It's important to remember, however, that although ADHD connotes a negative reaction in most of us, adults with ADHD may also bring many positive attributes to the workplace. ADHD sufferers are often highly intelligent, creative, outside-the-box thinkers, highly energetic, persistent, and willing to take risks. As a supervisor, remember, it's your job to hone in on your employees' strengths and build on them.
Adults in the workplace with ADHD may struggle with procrastination, trouble prioritizing work, getting to work on time, following directions, and making careless mistakes on tasks that are considered tedious. ADHD can be viewed as negative, but the truth is, people with ADHD are often highly intelligent, creative, and out-of-the-box thinkers.
Now, it's time to see how much you are learning from the information presented so far. When you're ready to begin, select Next. Select the correct option, then Submit. Now, it's time to ask yourself if you understand the information presented so far. For example, do you understand what we've said about what ADHD is, how it affects the workplace, the symptoms, myths versus facts, and the pros and cons? It is important that you know this information so that you can effectively manage employees with ADHD. Next, we'll take a look at what the law says and steps you should take if one of your employees is dealing with ADHD.
The Equal Employment Opportunity Commission, or EEOC, has developed guidance and regulations under the Americans with Disabilities Act, or ADA, addressing the employer's responsibility to make reasonable accommodations for employees with disabilities, including mental health problems such as ADHD. While the ADA does not provide a list of covered illnesses, it does provide guidance about what constitutes a covered illness. Depending on how severely an employee is affected by ADHD, the condition might be covered under the ADA. Reasonable accommodations are usually initiated following a discussion between the employee and employer. The employer is not required to provide accommodations that would create an undue hardship on the organization, and the employee is not required to accept accommodations that have not been requested or are not wanted. Examples of accommodations that might create undue hardship include demanding a secretary in a workplace that does not usually offer this service, decreasing a workload significantly with no reduction in pay, or constructing a new soundproof work area. Now, let's continue and learn about some things you can do that may be reasonable accommodations for ADHD sufferers. The Family and Medical Leave Act, or FMLA, is another option for employees suffering from ADHD. This law allows certain employees who meet eligibility requirements to take up to 12 weeks of unpaid time off from work while still maintaining their workplace benefits. This law has many eligibility requirements, and some states have different requirements. You should be sure you understand the full scope of your state's FMLA laws before granting any leave. In general, employees may request leave to care for their own serious health condition. Intermittent leave may be required if there's a medical necessity. You may require the employee to provide medical certification. FMLA provides a general definition of serious health condition that includes chronic conditions, conditions requiring multiple treatments, and conditions necessitating 3 or more days of missed work. This may include ADHD.
As a supervisor, you can help an employee with ADHD by offering organizational aids and help with prioritizing work.
Select each tab to learn more. For those with a short attention span, consider a change in schedule, a break in the routine, or a job where the employee can do something more stimulating. For those who are easily distracted, ask your department to keep their office doors closed and never use speakerphone. Or move the affected employee to a low-traffic area. You may also try moving the inbox to outside of the office to minimize interruptions. For employees with hyperfocus, who focus only on one area and may forget other important tasks or meetings, break tasks into shorter-term chunks and have the employee set an alarm to ring at predetermined times as a reminder of meetings. To help offset hyperactivity, encourage the employee to take several short breaks throughout the workday, especially those with a sedentary job. To help with memory problems, document all conversations with emails so the employee will have written records. Also, encourage the employee to use a day planner or carry a laptop or tablet to take notes at meetings. For time management issues, recommend that the employee arrive early for meetings and regularly review deadlines and work goals. To help deal with procrastination or overcommitment, frequently ask ADHD employees for progress reports on current projects, and again, meet regularly to discuss status. It may also help to break larger projects into smaller, more manageable tasks. As a supervisor, remember that you may need to adapt your leadership style to address the special needs of ADHD employees. This may be a trial and error approach, but it is always safe to use praise, patience, and flexibility. See what leadership styles work best with your employee and hone in on those practices. Your patience will pay off in the end because you will have a more productive and happy employee. Here are some ideas to consider in adapting your leadership style. Time management can be challenging for an employee with ADHD. You can help the employee keep projects on track by checking in frequently with the employee, or using computer-based reminders to prompt the employee to check the pace of progress. When assigning work or projects, make the best use of the employee's strengths, which may include creative thinking. The employee's creativity may provide a new and innovative approach to your business needs. Frequent communication and encouragement may help an employee with ADHD stay motivated and on track. Dividing large assignments into several smaller tasks may help with organization.
Now it's time to see how much you've learned about dealing with ADHD in the workplace. When you're ready to begin, select Next. Select True or False, then Submit. Let's take a moment now to make sure you understand the information presented during this training session. Do you understand what we've said about what ADHD is? Which workplace tasks might be more difficult for ADHD sufferers? What the law says about ADHD, especially in relation to FMLA and ADA? And what you can do to manage employees with ADHD? It's important to understand all this information so that you can effectively manage employees who are dealing with ADHD. Let's now finish up with a few key points to remember. The key points to remember about this training session are ADHD is a widespread illness among adults. ADHD can make certain workplace tasks more difficult. There are treatment options available for ADHD, and it may be covered under the ADA and FMLA. Know how you can help your employees who may have ADHD. This concludes the training session on ADHD. Please be sure to go back and review any information that is not completely clear. If you still have questions, be sure to ask your supervisor or trainer.